Diabetes put your feet at risk. Don't wait until it's too late. Hi, I'm Dr. Raymond. I am an orthopedic surgeon practicing at Sunway Medical Center, Damansara. People with diabetes are at greater risk of food-related health issues because of two main issues. The first one is actually the damaged nerves. Damaged nerves can actually lead to pain, tingling, loss of sensation or numbness. So this can lead to us not noticing cuts, blisters or sores at our feet. When this happens, it can actually lead on further to infections. Apart from that, there's also the damaged blood vessels, which can lead to poor blood flow. Poor blood flow actually can lead to poor wound healing. The common foot problems that can arise from diabetes includes diabetic neuropathy, in which you can have numbness, pain, loss of sensation or tingling sensation in your feet. This can actually lead to not noticing the sores over the feet, blisters, cuts, which if left untreated can lead to infections. The other foot-related health issues that can arise includes peripheral vascular disease, which is actually damaged blood vessels leading to poor blood flow. This is important because wound healing requires a good blood flow where you can get enough nutrients and oxygen to the feet. When there's poor blood flow, the wound tends to heal slower and this can again lead to infections. Other possible complications include fungal infection or athlete's foot. Apart from that, you are also at higher risk of developing corns or calluses and also ingrown toenails. Peripheral vascular disease or poor wound healing, if left untreated, can lead to infection. And infection in the worst case scenario can lead to gangrene or death of tissues. And when that happens, you may need amputation, in which you may need to amputate the foot or the toes. If you notice any discoloration to the skin or toenails, or even calluses, cuts, sores or blisters, any foul smelling, any pain or swelling, or any discharge, whether fluid or pus, you should always inform your doctor. So the essential daily foot care tips includes checking your feet daily. You should always use a mirror when you check your feet so that you can look at the sole of your foot. You should always find shoes that fit well and actually wear socks with them. You should keep your nails trimmed and filed. Maintain blood flow to your feet. When you're sitting, try to wriggle your toes often, or if they are swollen, elevate your feet. Apart from that, you should always moisturize your feet, but then do not moisturize in between your toes. So if you are in a hot area, you should apply some sunscreen to your feet as well. You should see a specialist when you have tingling or pain in your feet or legs, when you have loss of feeling, inability to feel heat or cold, when you have any changes to your nail or fungal infection, or even athlete's feet, or when you have ingrown toenails. You should also seek the specialist when you have any foot deformities, any diabetic foot ulcers that doesn't heal. For footwear recommendation, you should always wear shoes that fits, accommodates and protects your feet. You should wear socks in your shoes all the time. If you are at higher risk of getting a diabetic foot ulcer, you should always have a footwear on, whether indoors or outdoors. And before you actually put on the shoes, you should always check for foreign objects in the shoes to make sure there are no foreign objects or even penetrating objects in your shoes. If you already have a foot deformity, pre-ulcerative lesion or healed diabetic foot ulcer, you should consider custom in-shoe orthosis or insoles, which can accommodate and protect your feet. If you have a diabetic foot ulcer, you should consider an offloading device in order for the diabetic foot ulcer to heal.